soft transmitting.
Transmitted with a
I'd like to know about getting my church involved.
I had a nephew who just passed away. He passed away with AIDS.
It's scary. It's really scary.
This town isn't even aware that AIDS is here already. People with AIDS live here. And we've got a big drug problem in this town. And like the rest of the world, everybody's walking around thinking it's not going to happen here. It already has.
I really didn't take time to know about it, because to me it wasn't important until my brother died from it. That's when I really realized it shouldn't have to take for you to have death, close to you, to want to know about something that's killing up our society.
Everyone has heard about AIDS. Not everyone knows that 1 out of 4 people who have this fatal disease used intravenous drugs. To stop the spread of AIDS, communities around the country are trying to reach drug users and those around them with a strong message. Don't share needles. Get into drug treatment. Stop using drugs. And in every community, there is a different way to get the message out.
You can really change your behavior.
In Newark, Dr. Arthur Tayemba is taking a mobile health care unit into a city housing project.
Glass and stuff in the streets.
Here, drugs and AIDS will touch nearly every family.
The message isn't reaching the right people. The right people are those people who aren't brought into the healthcare system. Our approach is to educate people about health in general. It does not serve our purpose to address specifically AIDS when people are dying from drug addiction, alcoholism, heart disease. The biggest killer in our neighborhoods, it's not AIDS. The major killer is ignorance. And the only way that you're going to effectively reverse that is to sit down with them, take your time, and talk to them in language that they understand.
Okay? Gives you a brief description of what it is, okay, and how it's contacted, okay, how you get it. Contact point, all right?
They don't teach you a lot about AIDS in school.
They don't teach you a lot about it in school?
Okay. They don't have the time.
Okay, then that's why we're here, because we do.
Why don't you roll your right sleeve up as high as you can get? Oh, that's the problem. Okay. Ah, I see you used to mess around with, huh?
Yes. My opinion is, no, my facts is to use a condom when you're doing sex. No. Don't do drugs, apparently.
So that he told me that the doctor told him there's only certain ways you can catch it. And he told me the ways. Now, I have to find out for myself. That's when I go in there, I'm gonna talk to him about this.
Miss Gertie told me, to go in there. She told me about, they was in there discussing the AIDS, and they had the pamphlets for them. So I went in there to get them, to read up on it. To get some of these people that I know that do messes with the drug. They don't want to come in there, so I went and got the pamphlets to bring to them, since they don't want to come in there.
A lot of people, they go around, they say, oh, I'm scared to touch him. If I shake his hand, I'm liable to get AIDS, go home and eat dinner and give it to my whole family. I don't think it's quite like that, but people should get more information on it.
The most important thing is to reach into the community, because you really need the cooperation on the grassroots level. That's where the job is going to be done effectively, if it's going to be done at all.
And fighting AIDS means fighting the fear that comes with it.
As Surgeon General Koop says, you do not get AIDS from casual contact.
Any organization that deals with people needs to be educated. In suburban New Jersey, AIDS educators talk with a volunteer rescue squad.
Excuse me, what do you call casual contact?
I call casual contact.
Kissing?
Kissing, there are kissing and there is kissing. Most of us who kiss don't stop at kissing. They can't get a control group that will only kiss. Any volunteers?
We're here because we're first aiders.
Right.
What's our protection when we go to an automobile accident? What do we have to do to protect ourselves? Because we don't know who that person is, that victim. We've got to say victim. He's bleeding. He's hurt. What do we do?
Are you going to treat people different if you know they have it or if they don't? I'm going to ask you to upgrade the level of your own protection overall. treat every bleeding person the same. Use precautions.
We have to do things so much faster than we can put gloves on. You go call a guy in, hey, do it, and he's got to get in there. I'm a mechanic. My hands are cut all the time. What do I do when I go in there?
All right. What I'm recommending to you is take time to put a pair of gloves on. Keep them on your dashboard if you need to. Have them very accessible. All right. Before you leave, there's some very good information we've brought for you to share from the Center for Disease Control, from the New Jersey State Department of Health, and the National Department of Health. We want you to take this, read it, share it with your families. You make our job much easier if you do that. It'll be up here after the presentation. Please take it.
Yeah, my wife says to me every time I leave the house, be careful. Keep thinking in the back of your mind when you go on calls now. You know, I have a young child, another one on the way, and you think in the back of your mind, you know, if I get it, you know, is it worth it for me to go on these first aid calls?
I personally feel a little better, but I'm still not all that comfortable, you know, with the thought of, gee, am I going to get AIDS by helping someone else? I must be frank about that. I guess I'll have to make my own peace with that.
I'm 66, and if my daughters were going down the highway and had an accident, I hoped there would be somebody like these guys here that would help her, okay? And I'm still going to do it.
While community fear about AIDS must be acknowledged and dealt with, the primary target of AIDS education is the individual who practices high-risk behavior.
I started smoking pop, and then after that, I started doing coke. And when I started finishing the coke, I started using heroin. So I was sharing somebody's needle, and right there, I got the sickness of the virus.
It's very difficult to reach IV drug users. They're not reached through the traditional methods that you would educate the public. They don't get their information from the 6 o'clock news, let's say. We use people who are indigenous to the area, who have a background themselves of substance abuse, and can communicate to them straightforwardly and give them the message that they need.
Excuse me, can I talk to you for a second?
This girl that I know has ARC. Is she in remission? Does that mean she'll stay in remission for a matter of ARC?
There's a trust there. They speak the same language. One of the reasons I think that they're effective is, for instance, we talk about exchange of body fluids. Well, I don't know what that means to people. What we have to do is we have to communicate that same idea of exchange of body fluids in very simple, straightforward street language.
No, baby, look, no. You only could get AIDS through sexual intercourse or sharing needles. There's not too much education out there. Having safe sex, it's like condoms in the Spanish community aren't used very much.
It's like this, if you're gonna catch it, you catch it anyway.
No, you don't. Okay, do you have sex?
Yeah, hell yeah.
Do you use condoms?
Nope. I don't.
Do you know that you get AIDS through having sex through your semen?
Yeah, but how I know that she got AIDS? I won't use no condom. That's a straight shot. I won't.
So then you can get AIDS. There's 100% there right then and there that you can get AIDS through sex.
The condom.
I think they should be more educated in letting them know that this is an epidemic and it has no cure and it's no game and there are people dying.
But I got a wife. I got a daughter. Today, my wife, she don't want to be with me because what I got, she's scared. She do love me, but she don't want to be with me.
That's all you hear. My wife left me, my family don't want me there no more. I no longer exist, I belong to the family. So they have nowhere to run. They run out to the streets and do drugs. Some of them OD. Then they end up in hospitals dying alone.
They know about sharing needles, and they know that it is transmitted through that method. I think where there's a lack of information, and it concerns me, is that they don't necessarily know about the sexual transmission, meaning from primarily males, because the majority of intravenous drug users are males, to their sex partners and the potential for children to be born with the disease.
I started saying to my friends that they were shooting, they're still shooting. And I keep saying to them, you're gonna get sick. Because people are sharing needles and that, and you got a beautiful wife, and your wife could get sick about that. And damn, if she's pregnant, she's gonna get a son. Your son is gonna suffer for that,
So the ones that haven't made the mistakes yet, it's like, you know, protect yourself. Yeah, that's all I say, protect yourself.
Just reaching intravenous drug users and giving them the message is only a first step. This has to translate into behavioral change, or it has really no significance. If you know what causes AIDS, but you don't change your behavior one iota, then we haven't accomplished anything.
This is the protection.
It is.
Be careful.
One-to-one talk is effective and time-consuming. Getting the AIDS message to the public means reaching people in their daily lives. Jean is taking the message to Main Street.
Hi, guys. Can I put some literature out here and hang up some posters? Sure. For AIDS? Okay. Thanks. You're welcome. People are hungry for information. They buy those newspapers in the supermarket that say AIDS on them because they really want to know. And when I put the stuff in the stores, at least they're getting some accurate information. Most of the people I've talked to are afraid of the disease, and the only way they're going to learn that they don't have to be paranoid is by knowing how to get it and how not to get it. You know, sometimes an addict, all they care about is whether they get this stuff into them or not. They don't really care whether they get AIDS with it. You know, when you're hurting from needing drugs, you don't care whether you're going to die 5 years from now. All you care about is you're going to live today. Could I maybe put a couple flyers in your stores? Put some of these right in there?
Yeah, why not?
For the kids. I'll come back another day. I have Spanish literature, too.
Oh, yeah?
Maybe I'll come back and put it in the store.
That's very good.
Okay. Thanks a lot. Good. There's a lot of addicts who have cleaned up their act, and you know, maybe they won't get the disease. There are some people in the area that have stopped spreading it because I've started to talk to them, that they are positive, and they were doing the streets, and now they look at it like a loaded gun, and they're not going to kill anybody. So it works.
Handouts and pamphlets and posters do work to reinforce a clear and consistent message. But in today's world, radio and television are key educational tools.
So it's very possible for you to be exposed today, and if you were to go to be tested tomorrow, you would test negative because it takes your immune system 3 months to produce this antibody.
It's been my strategy, and certainly the strategy of other people in this work, to include the media because it's the fastest, cheapest, most effective way of getting the attention of a lot of people in a very short period of time.
As we say, it's not who you are, it's what you do.
I think a lot of times people are afraid of television. They feel that it is unattainable. And one of the things that we try to do with local programming is make the show accessible. So if people have ideas for formats of shows, they should pick up the phone, talk to the producer who's responsible for formatting and programming the issues on that show, and address those needs and concerns. And many times you will find the producer will be receptive to that idea.
What I'm going to do when I initially go on, I'm just going to inform them who my guest is. Then I'm going to have a few announcements. Then we'll take a break, and then I'll come back and introduce you. Okay. I think it's important to have shows on AIDS, and knowing that I do have a particular listening audience by this being a black radio show, and also knowing that in the black community there's a lot of apprehension and suspicion. I think it's important for us, if they look at us having some credibility, this radio station and the personalities that are on this radio station, and they have some trust in us. And I have as my guest this evening Miss Racine Winborn. Miss Winborn has been quoted in an article as saying that the black community has not taken this virus very seriously. We're behind maybe 5 years in our education efforts in the black community. We're going to try to address that this evening.
If you look at the current trend of this disease, you're talking about a lot of black and Hispanic people. The black community and the Hispanic community, either jointly or individually, are going to have to seize control of the education work, just as the gay community did when nothing was being done and that their own needs weren't being addressed.
The community overall has to begin to understand, and let's be very honest out there, we know somebody in our family, if not our immediate family, our extended family, who's had a problem or currently has a problem with IV drug use. when we talk about AIDS, we're coming right down a lot of people's streets. Now, many people may not want to admit it or own up to it, but that's the truth. And
We
so
are
we're not
trying to
talking
encourage our religious and political leaders to begin to educate themselves and begin to talk more about the infectious disease, because many people look to them for answers or what they should do, what kind of direction they should take.
I'm here to tell you that AIDS does not discriminate. Over 50% of the nearly 500 cases in Maryland have been black men, women, and children. Get the facts. Call the HERO hotline.
The calls to the hotline increased, I think tripled from the black community. What you had is you had a very high-profile, respected black leader saying, black community, AIDS is an issue that you've got to deal with. It's a problem. You want more information, call this number. And they called. They responded. And commit ourselves to talking about them, not advocating homosexuality, not advocating IV drug use, but advocating education.
There are groups like tenants associations, block associations, volunteer organizations, churches, etc. And these have a tremendous source of power and ability to reach people.
Why should I know about AIDS? Because your knowledge is the key to separating the facts from fiction.
This homeowners association in a comfortable Newark neighborhood has real concerns and hard questions for the AIDS educators.
On TV and the newspaper, you'll see children going to school and being denied admission to the schools. How dangerous is that kid with AIDS going to school to other kids that's in around them?
Suppose you were kissing someone and the person had cracked lips with secretion of blood could come through.
Yes.
Now, would that be a risk?
Yes, because you mentioned blood.
Yes.
That's the mode of transmission, the blood, not the saliva.
Yeah, I understand that. But the possibilities exist kissing someone.
Anything is possible, but it's not likely.
No.
To me, doctors don't know. You know, it's still in my mind, there's still a question.
You can't tackle everything, and you have to kind of pick the greater issue, which has the greatest urgency. And you have to accept in your community that not everybody's going to be happy, and you're going to offend somebody. But the issue is, what is the greater good of the community?
For teenagers, AIDS education has its own challenge. Young people are least likely to listen at the age they are most at risk. At El Puente Youth Center, students are first involved in a program of arts and learning.
Arts is a vehicle for raising the confidence of these kids, for improving their self-image. You can't tell kids wear a condom, engage in safe sex, don't share spikes, if they first haven't been told you are worth a lot. And it doesn't really matter what you teach them about preventing AIDS if they don't think they're worth it.
It's important to involve us. Don't talk to us. Let us get involved also.
From where I live and stuff, they just think, oh, it's for people who take drugs and stuff like that, and it's not. It could happen to everybody. So I think it's important for people in the community to really know what it's about.
What's really funny is that everybody, you can catch AIDS from shaking hands or drinking out of a cup or using a toilet, you know.
I hear like, don't kiss a person that has AIDS, you're gonna get it from saliva. I said, come on, people, get real. You know, I don't think so. But the thing is that people's fears reflect some people's ignorance.
I know that when I see young people that know about AIDS, I'm like, whoa. Why do you know about it? Why do you care about it? And then it's something else, because now it's like, ooh, this is hitting me directly. It isn't an older person, it isn't a doctor, it isn't the Surgeon General telling me. It's a person that's just like me.
With AIDS, the cost of bad communication is human suffering.
I was infected with AIDS through a boyfriend who I went out with for 6 or 7 months through having sex with him. But I had no idea that he used IV drugs. When we had been going out for about 5.5 months, he did use a needle to inject some cocaine in his arm. That was the first time I knew about it.
Do you know how many families are in their homes with the doors shut and the beautiful garden outside, dealing with this nightmare alone because they're afraid to reach out, to trust someone else? The people that I was working with AIDS were terrified to call the rectories or the parsonages because they were afraid they would get hellfire and brimstone if they went for help. And I formed a group called Interfaith Aid. And the people in it are priests, ministers, rabbis, and other chaplains who have been trained and who openly come and ask to be a part of this and go along that it will be totally non-judgmental care they'll give.
A lot of times I don't think I bring the church into it. Usually by the time I have gotten to dealing with a particular patient, a particular person, we're past that. I mean, here I have a person who has AIDS and is dying. It is not going to do them any good for me to sit there and start chastising about, you know, don't you know this is against church teaching to do this. We're beyond that point.
The first time Susan called me and I said to her, let's meet tonight for dinner and we'll talk. And she said to me, you mean you would eat with me? That's when I realized how much fear our people with this disease have in this country.
I felt that if people knew, they would just freak out and run away. I used to think about it all the time when I was in a room with people all around me, like on a supermarket line or something. I thought if these people knew right this second, they just all would take off or they'd run away.
I think if a community buries its heads in the sand and keeps denying, the situation is going to get worse. And when it finally does surface in their community, it's going to devastate that community.
No man cannot hinder me. Ride on, King Jesus, ride on. No man cannot hinder me. No man cannot hinder me.
Just about a year ago, by divine providence, we had our first experience with AIDS in this church. I recall very vividly when Pauline first came and how she gave her heart to God. You remember that Sunday morning? I recall embracing her right over there.
I wasn't sure of how to encourage the membership on how to relate to her. They had very little knowledge about what AIDS was all about. They constantly would watch me in terms of how I related to her. And I was somewhat forced into being a role model. I did not know an awful lot more about it than they knew.
And I'm reminded with great enthusiasm and with joy today of how many of you rallied around her and supported her, showed her love and showed her compassion.
I believe that in the position that I serve in as the minister of this church, that I must model love, I must model compassion and mercy.
I'm mindful that the Sunday just before she died, a group of the women of the church went over and sat by her bed and talked to her and kidded with her. Well, church, let's touch the lives of other Paulines.
Ride on, King Jesus. No man cannot hinder me. Ride on, King Jesus, ride on. No man cannot hinder me. No.
Dr. John Johnson is head of the Pediatric AIDS Clinic at the University of Maryland.
Has he still got the stitch holding the line in there?
It says the stitch right here, but it's not kind of the stitch right here where it's still on.
Uh-huh.
It's not loose enough.
But
this
is
is
the
the
stitch
stitch
pulled out of his skin?
Yes,
I
it's
see.
pulled.
It's really not doing any good there, is it?
Anthony was born with AIDS. He is now receiving a trial course of the experimental drug AZT.
So you're gonna get to it. And I'm trying to
I know, you're doing a good job, too. The prognosis for pediatric AIDS before there was any antiviral therapy was very grim. More than half of the children would die within 6 months of the diagnosis, 80% within a year of the diagnosis. So it's devastating, even more devastating than in the adult population.
Say I love you.
Sounds great. Baby, yeah. Everybody assumes that these mothers can in no way care for their children because they're drug users, and that's not true. This woman has done an excellent job in caring for this baby. She manages a central line in this child on a daily basis, flushes his IV twice a day. She's doing a lot more than just feeding and diapering this kiddo. When we pick up a child because they have AIDS, we not only have to tell the mother that the child has AIDS, but also that they are infected. And so it's a double shot, and it's very difficult information to handle.
Peekaboo. Peekaboo.
The other difficulty is that when, at least until now, when we've had to tell a mother that their child was infected, we are essentially giving them a fatal diagnosis for that infant. You know, we're all very proud of him and you for the sort of work you've been doing with him.
Thanks,
Really
Dr. Johnson.
I think you're wonderful.
I'm scared. I'm still scared. I'm scared now, but because I don't know when, don't know where and what time, or when it's gonna happen. But all I can just do is just pray every day.
For Anthony and for his mother, we have no easy answer. To stop the spread of this deadly virus and to care for those who have AIDS, our best and only weapons are education and understanding. This means that community organizations of all kinds must work together, share resources, and use every kind of communication tool available to educate themselves and their community. Every day counts.